All right, let's get right into it. Today, we are pulling back the curtain on a condition that is surprisingly common, and it could be the real reason your high blood pressure is so stubborn.
Does this sound familiar? You're doing everything right. You're watching your diet, you're exercising, you're taking your meds. But those numbers, they just will not budge. It is so frustrating, and it's a reality for millions of people. But what if the problem isn't something you're doing, but something your body is doing all on its own?
For a whole lot of people, the answer might be a condition called primary aldosteronism. Now, I know, it sounds super complex, but we're going to break it all down today. And here's the thing. For many, understanding this isn't just about managing high blood pressure, it's about the very real potential to cure it.
So, to really get what's going on, we have to meet the main character in our story, a hormone called aldosterone. The easiest way to think about it, it's your body's official salt manager.
Okay, so aldosterone comes from your adrenal glands, these little guys that sit right on top of your kidneys. Its main job, its whole purpose, is to tell your kidneys to hold on to salt. And you know the saying, where salt goes, water follows. So by managing your salt and water, aldosterone is absolutely crucial for keeping your blood pressure stable. It's actually a pretty amazing system.
The best way to picture it is like a thermostat for your blood pressure. When your pressure dips too low, your kidneys sense it, and they send out a signal called renin. That signal kicks off a whole chain reaction that basically tells your adrenal glands, hey, we need some more aldosterone over here. Aldosterone gets released, the body holds on to salt and water, and boom, blood pressure comes right back up to normal. It's a perfect feedback loop when it's working right.
But what happens when that perfect, finely tuned system goes rogue? Well, that brings us right to the heart of the mystery. What in the world is primary aldosteronism?
Simply put, in primary aldosteronism, the adrenal glands just stop listening. They start churning out aldosterone all on their own, even when the body is not asking for it. That beautiful feedback loop we just talked about, it's broken. Your body is practically yelling, stop, we have way too much, but the adrenal glands just keep on pumping.
So, what's causing this little rebellion? Well, it usually boils down to two main culprits. First, you've got something called an adrenal adenoma. This is a small, harmless tumor on one of the glands that acts like a tiny rogue factory, just working overtime pumping out aldosterone. The other cause is adrenal hyperplasia. This is where both glands get a little too big and become overactive. So one rogue factory versus two overactive ones.
The signs can be a little tricky. Of course, there's the high blood pressure that just won't quit. And since aldosterone makes the body get rid of potassium, low potassium levels are a classic clue, which can make you feel weak or tired. But, and this is so important, sometimes the only sign is high blood pressure that's hard to control. That's it.
Okay, so if the signs can be that subtle, how on earth do doctors crack the case? Well, the diagnostic process is actually some really cool medical detective work.
The whole investigation kicks off with a simple but really powerful blood test. It measures two key things, aldosterone, the hormone we've been talking about, and renin, that first signal that comes from the kidneys.
And the logic here is just brilliant. Doctors look at the ratio between the two. Think about it. If your aldosterone level is super high, but your renin level is super low, that's a massive red flag. It means your body is trying to shut the system down by keeping renin low, but the adrenal glands are completely ignoring the signal. A ratio of aldosterone to renin that's greater than 20 is the key clue that tells doctors they are definitely on the right trail.
This table really lays it out perfectly. In primary aldosteronism, the problem is in the adrenal glands themselves. They're making high levels of aldosterone, so the body slams on the brakes by making very little renin. But in what's called secondary aldosteronism, the high aldosterone is just a response to a problem somewhere else, like the kidneys are screaming for help. In that case, both renin and aldosterone are high. That low renin level, that's the smoking gun for the primary kind.
So once the blood tests point to primary aldosteronism, the next step is to find the source. Is it one rogue gland or is it two? An imaging scan like a CT or an MRI can help look for a tumor. But to be absolutely sure, doctors might use a more precise test called adrenal vein sampling. This test can confirm exactly where that extra aldosterone is coming from.
And pinpointing that source is absolutely critical. Why? Because it leads us to the best part of the story. Two very different causes, which lead to two very different and often curative treatments.
And this is exactly why that detailed diagnosis matters so much. You have to match the solution to the problem. If the cause is that single tumor, that one adenoma, the fix is often a minimally invasive surgery to just take out the rogue factory.
But if the problem is hyperplasia, where both glands are overactive, surgery isn't the right move. Instead, doctors use specific medications that block the effects of all that extra aldosterone. Now get this. This is where the story gets really, really hopeful. For patients who have that single tumor and get the surgery, somewhere between 50 and 70% of them are completely cured of their high blood pressure. Cured, as in they don't need medication anymore. That is an absolutely incredible outcome.
And that is the biggest takeaway here. For so many people, high blood pressure is just a lifelong thing you have to manage. But when primary aldosteronism is the real cause, the whole conversation changes from management to cure. It's a total game changer.
This quote from the MSD manual really drives the point home. This condition is being recognized more and more, even in cases where you don't see those classic signs like low potassium. It really suggests that this could be way more common than we ever thought.
Which leaves us with one last big question. How many people out there with so-called essential hypertension, meaning high blood pressure with no known cause, actually have this specific, treatable, and often curable condition? Is one of the most common causes of high blood pressure hiding in plain sight this whole time? Definitely something to think about. Thanks for joining us.